All right, so if you're dealing with some type of hip pain or hip tightness or low back pain or tightness, then you need to grab a ball and you need to try this glute mobilization. So one of the main reasons why we have people come into my office for some type of hip pain, some type of low back pain or tightness in either of those areas is because there is dysfunction within that glute complex. All right, so the main thing that we're trying to do with this exercise, this glute mobilization, is a pin and stretch. We are gonna get into 3 different spots within that glute complex. So we're gonna start right behind your front pocket. So what I wanna do is I wanna locate my hip bone, that pelvis, I'm sorry, not hip bone, the pelvis bone. And then right at the top of that ridge is where I wanna go slightly below. So you wanna think like belt line. So we're gonna start right behind your front pocket. We're gonna get to the middle, and then we're gonna get right to that backside towards the tailbone, but still stay in that meat of that glute tissue. All right, so what I'm gonna do is take that ball, I'm gonna get to that first spot, and you can see I'm laying on my side and I'm propped up on my elbow. Now, this is going to be tender. I will warn you about that this is gonna be slightly uncomfortable, but that's what we need to really get into that tissue. So once I lay on my side and I find that first tender spot, once it's locked down, I'm gonna keep it there, and then I'm just gonna rotate my knee back and forth about 8 to 10 times. What I'm doing is I'm pinning that glute tissue down, and then I'm stretching it by going into this adduction or bringing my knee to my other knee. Do that 8 to 10 times, then we're gonna find that second spot. So to show you, what I'm doing is I'm not going down into more of that cheek, I'm staying high up. So I started here, I go to here on that second spot, right in the middle of that glute, and then I just find a tender spot. It doesn't have to be exact. If you can find a spot that's tender and it feels restrictive, so as my knee goes up, I find a point where I can't go anymore, that's where you're in a good spot. Again, I'm gonna do 8 to 10, and then I'm just gonna roll my body right onto that third spot, right next to my tailbone, and just trying to get through more range of motion each time that I do this movement. So the main thing is that you find 3 spots on each hip. This should only take about a minute or 2 on each hip. So this shouldn't be something you have to spend 20 minutes doing, just rolling around on a ball. You wanna make sure that you're being effective and trying to go through as much range of motion as you can as you do each section. But as long as it feels slightly uncomfortable and it feels like you're getting some of that restriction as you move that leg, you're doing it right. If you guys have any questions about this glute mobilization drill, drop them in the comments below. If you like this video, please share it, like it, subscribe to my channel, and I'll be happy to make more videos about different types of mobility drills that are gonna keep you pain-free and help you recover faster.